Hello, everyone. Welcome to Webinar Wednesday, today on November 1st, 2023. My name is Melissa Haddad, and I will. Of Durham exists on lands that the Mississauga Anishinaabe inhabited for thousands of years prior to European colonization. These lands are through the traditional treaties of the nations covered under the Williams Treaty, including the Mississaugas of Scugog Island First Nation, Alderville First Nation, Hiawatha First Nation, Curve Lake First Nation, and the Chippewa nations of the Georgina Island, Beausoleil, and Rama. Recognize, honor, and respect Indigenous peoples as rights holders and stewards of the lands and waters on which we have the privilege to live. In our efforts towards reconciliation, we continue to build and strengthen relationships with First Nations as well as the large Métis communities and growing Inuit communities here in Durham. We commit to learning with the Indigenous values and knowledge, building opportunities for collaboration, and recognizing that we are all connected. Please share in the chat the territory you are joining from. Today's webinar is Virtual Assistance for All, Leveraging Automation and Artificial Intelligence in Primary Care. This session is part of our Webinar Wednesday Healthcare Innovation Rounds series and has been certified for Mainpro Plus credit. It is my pleasure to introduce Dr. Mohammed Al-Arakia. Dr. Mohammed?
Great. Thanks very much, Melissa, and it's great to see everyone today. This is the first in our innovation series of Mainpro accredited sessions, and there are a number of others sessions coming, so just would encourage you to attend, and certainly this session is for everyone, really there to hopefully have a dialogue around some different things. Today we're going to focus on leveraging automation and AI in primary care. So I'm Mohammed Al-Arakia. Again, I'm a practicing family physician in Ontario. I'm the CEO of the Health Center of Excellence. I'm the faculty digital health and innovation lead at McMaster Medical School at the Waterloo Regional campus. It's really great to join you today. I'm joined by the brains of the operation, Justin Vaulting, who's a manager of product development and innovation at the Health Center of Excellence, and he's going to be helping me out with this topic and the tough questions that you're going to send our way. There is a chat feature, and we'd like you to use the chat feature to send questions. Please send them throughout the presentation, and we will answer some of them along the way, and then we'll have ample time to answer them at the end. This really is an opportunity, I think, to look at, where should we go leveraging automation and AI, and particularly in the community, which often has less support than other sectors in terms of moving forward with these technologies. So we'll go to the next slide. We wanted to just start with disclosures. So both Justin and I work for the eHealth Center of Excellence, and so there is a financial relationship there. I also sit on the board of Digital Health Canada. Neither of us have any patents, so we're not going to get rich soon. And as I mentioned, we do work for the eHealth Center of Excellence, when we'll tell you more about the organization coming up. We'll move to the next slide. We do get funding at the Health Center of Excellence from governments and government agencies and various health service providers. So wanted to note that. We'll move to the next slide. And in terms of conflicts, we will sort of identify them throughout. We're not making any therapeutic recommendations in this presentation. So we'll go to the next slide. I'm just going to take a pause and just drink some water here. So what do we hope to achieve today? We really wanted to talk to you about digital tools that can support the reduction of administrative burden. We're going to talk to you about a few examples of where artificial intelligence is being used in healthcare to make some tangible benefits. And then what are the future opportunities around automation and artificial intelligence, and where can we go? And we welcome your ideas as well. I think there's a lot of activity out there on automation, artificial intelligence, and certainly there are enough problems to solve. So we really want to start a conversation about that, and how can these technologies be used in an appropriate way to support clinicians so they can care better for patients. We'll move to the next slide. So just starting with some background, what is the Health Center of Excellence? It's a not-for-profit organization that works across the country. It's supported over 10,000 physicians, nurse practitioners in the community across the country. The expertise is around a number of different things, but we really focus on change management, supporting clinicians with different changes in processes so that they are able to then implement technology within their practices in a way that hopefully improves their life and improves the life of patients. We do evaluation, so knowledge translation and evaluation of digital technologies and interventions to see if they actually are making a difference or not. And we support project management as well as things that, like you'll see today, looking at developing technology and then deploying technology within the environment. We do a number of different things that you can sort of see on the screen there, and we're happy to get into some of those as questions arise. Today, we're going to be focusing more on the automated solutions and artificial intelligence. We also do cybersecurity, which is a new thing that we're doing across the country. That's also Mainpro accredited, and it allows clinicians and their teams and their staff to get up to date on what they need to do to protect versus cyber attacks. You can get more information on the website at the bottom, and that will also be at the end. What do we do as an organization? Really, the key is to be the leading trusted digital health partner for primary care and integrated care. Keyword is trust, to make sure that we do it in a way that makes sense, that is evidence-based, that goes into a direction that helps clinicians deliver patient care, and then stops doing things that are not helpful. We'll move to the next slide. So we know burnout is a big problem. We know technology is a significant cause of burnout. Family physicians are spending many hours in one analysis, 19 hours on administrative work per week. This is contributing clinician burnout, clinicians leaving the practice. And it's a shame because we don't have enough clinicians, particularly in family medicine, to support our patient population. In Ontario, my home province, there are 2.2 million patients that don't have a family doctor, and increasing rapidly will be 3 million over the next few years. We know that there are other jurisdictions that have moved forward with reducing administrative burden for clinicians. The NHS has moved forward with reducing administrative work to 10% of a clinician's week. And Nova Scotia has set to reduce the administrative burden by 10% next year. And so it really, there's lots of work happening on this. There's work around, things like simplifying forms, not making clinicians responsible for ordering tests that they don't need to order, things they don't need to sign off on. There's lots of work on team-based care, looking at how do you support patients with care teams, integrated care teams, interprofessional primary care teams, so that the burden is not on the physician or nurse practitioner. And so a lot of different things, and I put forward to you automation and artificial intelligence can be some of the things that can reduce that admin burden on clinicians if we do it in a thoughtful way, and if we do the right analysis to actually see if that they are doing that. Studies have shown that clinicians, or surveys have shown rather, that clinicians don't think they should have zero admin burden. That there is some admin burden that is expected, but it shouldn't be 40% of your time is spent on administrative tasks. The Canadian Federation of Independent Business did an analysis, and they said that 18.5 million hours is spent on unnecessary paperwork per year. That's equivalent to 55 million visits. So if we're even looking at reducing that by 10%, we could have 5.5 million more visits to clinicians. And of course, we want to give time back to clinicians for their own health, for their family. And so there's an opportunity to tackle this, but we need to look at what are the different tools that we have that can help us do that. We'll move to the next slide. So before we do that, I think we're all keen to jump in and try to solve problems. We need to do so in a thoughtful way. And the way to do that is by really being empathetic about what clinicians are going through, and of course, what patients are going through, to understand from the clinician perspective, what are they dealing with? What is actually happening in their day, in their clinic? I was in clinic this morning, and saw patients. I had to do a number of forms, and I needed to look at lab work and diagnostic imaging, and I was on call previously, so I had to follow up on some of those things. And so there's a lot of things coming at clinicians. And so understanding that, understanding what the issues are, defining exactly what the problem is really important to make sure one really understands the problem in a clinical setting, and then thinking about what are the ideas that are there that can solve that problem in a real way, and making sure you involve clinicians within this entire process, and then trying things out. And we will talk today about some things that we've tried out over the last number of years and are refining and getting better and testing it in the clinical environment. Then once we've done a prototype, and making sure it works, and then scaling and spreading. And that's a problem that we have in this country, is we don't scale and spread things that are working very well. And so, I think we need to do that and need to move forward in doing that. What I've just talked about is an approach to design thinking. Stanford has published a lot on this. They have a school around this, and I encourage you to go to that link and learn about that. I think we can always talk about technology, but if it's not solving the problem at hand, the problem that's most important to those that we're implementing the technology to, often it leads to more burden versus less burden. Justin will later talk about HEAL, the approach that we've taken as an organization in terms of solving problems, and we've really defined that and are looking to do that for everything that we're looking to tackle. We'll move to the next slide. And so one of the potential solutions is AI, and I talked about empathy. And so this was a study in JAMA Internal Medicine that looked at a number of questions that patients had posed online, 195 questions, and then they looked at physicians answering those questions and AI answering those questions. And AI had more empathetic and better quality responses as judged by healthcare professionals, right? So there is value to AI. Now, this is a small study. There's a lot more for us to look at, and by no means do I think I'm going to be on a beach somewhere and an AI bot will take my job. But AI can help with some of the things, and can help with some important tasks. And so I put forward to you, AI is very good at summarizing information. It can take a lot of information and summarize it, so the clinician has it available. So if you have a patient with a particular characteristics and a particular condition, AI can give you the information that would be relevant to that patient. And so then you can look at that. And there are a lot of things, and hopefully we can have some discussion about, what is dealing with bias in terms of data sets, and what does AI base its decisions on. But there is a tremendous power there to summarize large bodies of information so that clinicians can have that available. The second thing AI can do is then you take it a step further and provide decision support. Can say, this is the next step in this particular patient's journey. This patient has heart failure. They should be on this other medication, and this is why they should be on this other medication. So the other important thing is about just being transparent and understanding in a transparent way why AI is suggesting something. It's not, people talk about explainable AI, where everything is explainable. That has some problems with it. We expect AI to come up with solutions that there may be some other logic there that we might not fully understand, but knowing what it's using to come up with that answer will allow us then to do some tests and trials to see if it's coming up with the right answers or not, and in a very thoughtful way, see if it's actually giving us a new, better perspective on something. And then if we are actually finding that, to move forward with larger scale implementation. We also know that artificial intelligence can drift a little bit. The models can drift over time. And so it's important for us to constantly be checking in and understanding what the AI is doing. But AI is here, and AI is going to play a role in the future. And so it is, what I like to refer to it as is augmented intelligence. AI just allows us as clinicians to have the information available, understand some factors that we might not be thinking about, and then make a decision between us and the patient. So maintaining that patient-clinician relationship. So it's a tool like any other tool that will allow us to hopefully improve patient care if it's implemented in an appropriate way. And I think there's a lot more work to do on looking at what that exactly means. I'll talk about one example about how we're looking to use AI. So Justin, if you go on to the next slide. So this is the example. So we have deployed an electronic referral system. We're supporting a number of provinces with this. Electronic referral is really about taking this really challenging process where I'm seeing a patient, I'm trying to get patient to the next service, I'm trying to get a patient to an ear, nose, throat doctor, for an example. And it's often hard to know where to start. I will start with the clinician that I know down the street and I'd refer, but what if that clinician's wait time is like a year, and then there's another clinician maybe 20 minutes away that their wait time is 3 months. Right now it's just a shot in the dark. You're referring patients off and you're trying to sort of do the best you can, but you only know what you know. And so taking that process right now, which is largely facts-based, and digitizing it presents some opportunities with understanding what services are available, all the specialists that are available, understanding the wait times in real time, the patient understanding those things and being able to follow their referral, like they would a package online. So there's some opportunity, some benefits of digitizing the referral process, but there's still some challenges with respect to that. And so can AI help with that? So we'll go to the next slide. And there's a bunch of animation here, so I'll let Justin click through it while I'm talking. Is that if I'm looking at referring a patient to a specialty, and say there's a number of different specialists that are available, what can we predict, or can we predict how long a patient would take to get to that specialist? So sort of like if you use Waze or you use Google Maps and you're looking to go to a particular destination, you're going to get different routes in that destination. And so what we've been able to do with referral is, because we capture the data electronically in terms of referrals, is we've been able to use AI models even before a patient is referred to tell you what the expected wait time is for the different specialists. So we've got different data about the patient, we've got data about the specialists and about wait times, and then we use that to say, this patient with moderate osteoarthritis and heart failure has this potential wait time for these different specialists, and this would be the best wait time for that sort of patient, and this is where you should refer them. It might be farther away, but that's going to be the shortest wait time. And then there's a conversation with the patient about whether they want that wait time or not. And so there's different things that are moving here, where like this is where the specialists are separate and you would refer them to individually. There's a central intake that are happening across the country, where you would then, the central intake could use something like this, where it could look at which specialist would be the next one that we would send the patient to in a more automated way, versus having a person actually look at that and do that. So artificial intelligence in this case has a role for helping to navigate the patient through a system, to understand the services and what services are more easily accessible to the patient, or faster to a patient. And then again, it is about the patient still having choice of who they want to see, which geography they want to go to. But this will support the conversation between a clinician and a patient, where you can actually then say, okay, here, this is the predicted wait time. The actual, this is what we actually think is going to happen. Is that okay for you? What happens today is you send a referral off and you get either a note rejecting a referral, saying, okay, the wait time, we can't tell you yet, or the wait time maybe is like 12 months. Is that okay? And then you have to do back and forth after the fact. This way, right at the point of referral, you can determine how long it is. So AI has a role in helping you to predict what something might happen, and then having that conversation. AI can also help with what services would this patient need. So as a clinician, I get thrown lots of information about different services in the community and in hospital that a patient could benefit from, but I can't keep all of that in track in my brain for patients with, hundreds of conditions, can AI actually summarize that and say, this patient would benefit from these 3 services that are available in the community, they meet the criteria for, it seems to fit with their profile. So then I can, again, talk to the patient and say, these are the things that you would actually benefit from. So that's some work that we're thinking about doing moving forward. And I think, again, we'll present an opportunity to look at how do we maximize the resources in the community that are available that we might not know about, and extends the clinician's brain by giving the clinician additional information. Now, someone's lost the audio. Can you guys hear me okay, Justin, Michelle? Okay, you can. Okay, so it might be on your end. So just hopefully that can get sorted out. And with that, I'm going to hand it over to Justin, and he's going to do the next part of the deck.
Perfect. Thank you, Mohammed. And as Mohammed mentioned, my name is Justin Walting, and I'm going to talk about a number of different components today for the rest of the presentation. But I will start with automation technology and something called robotic process automation, and tell you all the different exciting work that we're doing here at the Yale Center of Excellence. And so starting really from the beginning here, you may have heard the term robotic process automation or intelligent automation or software robots and might have wondered, what is this? And really quite simply what this is it's referred to as a robot, and it replicates the actions of a human that would actually be interacting with the digital system. And so if you think about a human that might be going into an EMR system, running a search, finding patients, doing follow-up actions, running reports, all of those different types of actions within the EMR, we can actually program a bot to do those automatically in the background. And so with being able to do that, there are a number of benefits from the use of this type of technology, which a few of them are here, which are worth highlighting, including that bots can basically run 24/7, 365, because they don't need to do things like eat, sleep. They work with existing infrastructure so that we don't need to be building sort of complex interfaces between systems. The bots can actually use existing technologies like a VPN software that employees would actually already be set up. We can actually set up a bot in a very similar way to access a system. Mohammed had mentioned kind of, this type of technology is really supplemental, and these bots are the same in that they complement clinician work. They can work in the background, they can communicate with clinicians, they can do things kind of and helping them along the way. And then support employees. Bots are really fantastic at being able to take on some of that administrative burden, which Mohammed also spoke about, and we'll get into some of the details about that in the coming slides. And so there, again, are a number of benefits from using this type of technology, and we've just sort of highlighted just a few of them that are here, and the list goes kind of on and on. They can do things like being able to create alerts and reminders directly within the EMR that integrate right into clinician workflows. It can really reduce the amount of time that you need to record your data and analyze data. Bots are really good at being able to go in and aggregate, collect, and present data in a very concise and digestible way. Bots are able to do all of that background work in terms of being able to identify patients that are in needs of services. And in the case of one bot that we're going to get to, can actually perform that outreach automatically. It can engage with patients in a number of ways to that point, in terms, including things like surveys, questionnaires, forms, messages, and things like that. And then really importantly, bots, in terms of that identification, can actually find patients that are at risk and can find them early, because they can work in that background and we can continuously looking for patients that are at risk for a number of different things, like certain diseases, or patients that are at risk for maybe even things like hospitalization or ED visits. And so what I'd like to introduce to you, if you haven't already seen it before, is that we do support clinicians with automation, and we actually have our own department here called ECE Automates, really, which is all about developing these bots, or these virtual assistants, as they're also known as too. And so this is our family. We call them the family of bots. And I'm actually going to go into lots of detail on each of the bots and how they work. And as you can see, we've actually named the bots, which is very fun. And we've actually also named the bots in a way where It kind of describes a little bit about what each bot does. And for example, you'll see Cody on the screen here, which is really stands for coding, helping coding the EMR and help with data standardization, which we'll get into. And just want to highlight that this has been work we've been working with over 500 clinicians across the province and over 65 clinics at that point. Really looking to spread and scale a lot of the work that's been done here, like Mohammed had mentioned, but we're also developing new bots as well, and we'll get into some of that work a little bit later in the presentation. And so, like I mentioned, I will go into some pretty good detail about how these bots actually work, so you can visualize this a little bit and how this might actually look in your practice. And so what you'll see over the next few slides are really kind of a little diagram of how the bot works. And you can think of it of kind of moving from left to right in terms of how the bot actually works. And so, like I had previously mentioned, the first bot that we'll talk about is our Cody bot. To me, which is really a kind of a foundational bot that really enables a lot of different type of work. But really kind of to summarize it, our Cody bot is able to help with data standardization and cleanup through the standardization of coding patient diagnoses in the EMR in the problem list. And so what this allows is to be able to basically, for 18 different conditions, be able to have standard coding within that problem list, so that you're able to identify these different patient populations much easier than just running a search and hoping that you're able to look through free text and things like that. And so the way that our bot works is that the bot connects remotely to the EMR using secure methods like a VPN. It will run a search for a specific condition, such as diabetes, and it will look for patients that have not previously been coded, but have the word diabetes or have a certain A1C in a certain range, things like that, the bot suspects needs coding. The bot will then actually go chart by chart and will open each one, and it will go and it will find that entry that said diabetes or a different variation of it. And it will actually add either the ICD-9 or SNOMED CT code, depending on which coding system your clinic may use. It will actually add that directly into there. It will then generate a report at the end of the run that you can look through, and it'll actually send messages directly within the EMR to the clinician or to someone else at the actual site on a patient-by-patient basis, so you can see exactly what the bot was able to do. And so we'll run this for 18 different conditions, and at the end, what you have is for these 18 conditions, your whole patient population is coded. So as mentioned, these are the 18 conditions on the left-hand side here. We are also working on adding more conditions into this list as well. On the right-hand side, under step number 2, you'll see that someone had, in this case, had put hypertension in free text, and below in the middle there, or a little lower, is where the bot actually added 401, the ICD-9 code. And then our bot is actually able to do things like put in a custom form or put in information directly into the patient chart that a clinician can then interface with. And this is something that's completely optional, but if a clinician is interested, you'll see this form at the bottom of this slide right here, where the form goes into the charts, and it can say for this patient exactly for what condition it ran for, if it did actually end up coding the condition and with what code and when, and then it will actually tell you why this patient was picked up. And that gets a little bit to what Mohammed had mentioned earlier around the explainability and why this patient was picked up and why they were coded. This type of form here can show, this patient had a certain lab maybe in that range, or there was a text match. And in this case, there was an exact text match. And that's why this bot had picked up this patient. And then a clinician can actually type into those response comments, which is highlighted at the bottom there. And the bot can actually look at that on the next run and interface with that. So there's a bit of an asynchronous communication that can happen back and forth between the bots and the clinician as well. So that's really the bot kind of from the start to the finish. But then how do we use the bot, and how do we kind of build that into some more complex and bigger types of work? And so one example of a project that we had done was around doing some population segmentation with data using the Cody bot, but then using a number of other components as well. And so what this project that we had worked on was, again, using the Cody bot, was then also bringing in some social determinants of health work, and then running complex patient algorithms that were actually finding patients that were at risk for ED visits or hospitalization. And the bot and the algorithms were actually able to identify patients that were medically complex, socially complex, and both. And we were able to then be able to provide some information to clinicians or to different sites, and they could actually receive these lists and have this information. And then they would be able to kind of leverage some of their own internal systems within their OHT or their family health team and provide that proactive management for these patients. So being able to reach out early and create a referral or refer them to a different program or things like that. And so this was an example where we took a bot and we took some other components as well and combined it all together to help find complex patients and do that. So bots are really great at being able to work together and work with other types of functions in order to kind of achieve even a higher purpose. So that was our Cody bot that we had. Our next bot that we're going to talk about is our Bernie bot. And our Bernie bot was named because it's trying to reduce burnout. And what you'll notice for this Bernie bot is that it has a number of different functionalities that all kind of go into that theme of trying to avoid burnouts. And so just like the Cody bot, I'll talk in good detail about how each one of these works as well. And so the first function of our Bernie bot is that it's able to find patients that are due for a visit for diabetic patients that are due for a visit, and can also identify missed billing opportunities for patients. And so this is a great bot that actually builds off of the Cody bot. So after you've coded your diabetic population, you can then run this Bernie diabetes bot where you can actually run a search for all your diabetic patients, and you can see in the past 12 months how many visits that they've come into the office for. And you can identify how many times they've been billed for K03As and Q040As. And then from there are a few different permutations for then some different follow-up actions that can be done. So the patients might be due for another diabetic visit because they'd only been seen once in the past 12 months. Maybe they've had all their visits and they are missing a few billings, so some K030s. Or maybe they've actually been billed for all their K030s, but they're now eligible for their Q040. And so what happens is the bot can take all of those different scenarios, it can basically generate a summary message and be able to then send that to somebody at the site to say, for this patient, they need this many visits and they are due for this many billings. And really what that's being able to do is really the two components mentioned is that this is providing proactive care to make sure that patients are coming in and following best practices, being seen 3 or 4 times a year, and also just making sure that there aren't any missed billing opportunities along the way for the clinician as well. Our second function of our Bernie bot was some work that we had received. We received a CMA Jewel grant, and so this was some enhanced functionality. And this was able to do a somewhat similar piece, but what this bot can do is actually identify patients that are due for different lab work and make sure that the lab has actually been done. And so the way that this bot works is that it will, again, connect to the EMR. It goes through your patient population and it will look for different medications that need certain lab testing. So for medication A, it might need lab testing X, Y, and Z. And it will go through all of the different medications, and it will, for all those different lab tests, it will see whether they're overdue and whether that they've been done in a frequency that's been set by the clinician. And for any lab value or for any lab that has not been done in that time period, what the bot can actually do is fill out a lab requisition, and then it can put that directly in the chart, and then it can message the clinician to say, this patient is overdue for these different labs, and a lab requisition is in the chart, and then it's then easily able to be sent to the patient right there. And so our next steps that we would do with this bot is able to actually automate kind of that outreach part of it. But the bot does really the heavy lifting in terms of understanding for all of the medications that this patient is taking, which lab tests are overdue. And sometimes there are overlap between those pieces, and sometimes depending on the medication, even sometimes different frequencies, and all of that can be customized by the clinician as well on a run basis. And then finally, our last function within our Bernie bot is our Bernie COVID vaccine bots. And this is a bot that a couple years ago was one where we had responded to a very increased needs, and people may be aware that as vaccines were coming in kind of in the early days, they were coming in via HRM into the charts. But the big problem was that that information was then just sitting in the charts as free text and was not going into the proper immunization section, which made being able to identify the different patient populations of patients that had no shots or one or two or more very difficult. And so this bot had a primary purpose in being able to go into the chart, be able to find the information of vaccine information that came from HRM, and then put that information into the immunization section, just like anyone would actually type it in. And so the bot would go in, it would run a search to find all these different patients, extract the HRM information that it found. It would then compare it to the immunizations that were already done in the immunization list. And if it was already entered, it would say great. And if it wasn't, then it would actually go in and enter each piece of information in. And what was fantastic about this at the time as well, when it was such a burden to clinicians and to administrative staff to actually enter this in every time, what we had seen was that really only the minimum amount of information from these vaccines were actually going into the immunization section because it was so much work. So things like some of the different adverse effects or the other components that some other comments and things like that were part of that HRM report, if it wasn't being done by the bot, was sometimes not reflected in that immunization section. And so the bot was able to take all that information and enter all that in automatically in the background, which was also kind of improving that data quality and standardization as well. And I will just highlight that there is a video demo for this as well. It is noted at the bottom here. And I would encourage everyone to, so this is a link to one of our videos under our YouTube channel. We do have a number of videos for other things as well, so I encourage people to look at that. But if you're interested in looking at how this bot works directly, please follow this link here. And it's only about 3 or 4 minutes, so you can see exactly how the bot is doing its work. So our second last bot we have here is our Sharon bots. And for those with a kind of a keen eye and have been thinking ahead, this is a bot around sharing information. And specifically in this case, what our Sharon bot does is it's actually sharing information from the coordinated care plan or the shared care plan between primary care and home and community care. And so this one is a little bit more complex in terms of the data flow and how it works. But what you can see here is what the bot is able to do. And actually, maybe I'll start with kind of the core problem here. And so what was happening is that coordinated care plans were being filled out by both primary care and home and community care in 2 separate systems. And so when a care plan was updated in one system, what was happening without the use of a bot is that that information was then faxed, or there was an email or something like that trying to communicate to the other side. But it was very difficult to then be able to take that information and update it in both sides and keep things in sync. And what ended up happening is that this process would break down and people would not use it. And so what the bot is able to do is able to basically be able to look into both systems and see both of the care plans. And when an update is made, it can look at both and it can synchronize information. And so the way that this works is that the bot will start in primary care EMR, and it will look for patients that have a care plan and any updates to a care plan. It will then be able to go into the HBG or Health Partner Gateway system, which is on the home and community care side. We'll find that same patient and find that version of the coordinated care plan. It can look at each of the different sections and it can see the date and timestamps from when each one was updated. And based off of all that information, it can then actually update the care plan on both sides. So it's bilateral or bidirectional updating. So really the end result that you get from this bot is the same information in both sides. And similar to our other bots, the bot will be able to send either like an email, or it can send an internal EMR message also to the clinician or to somebody at the site saying this information, or this patient had an update to their care plan. Please go take a look and see. But solving a really big problem with these different siloed systems that need information shared. So this is how our Sharon bot works right now. And then finally, our Poppy bot, which I'm very excited to talk about a little today, is really our newest bot that we have. And this is a bot that was designed in collaboration with the East Toronto Health Partners, OHT. And this bot is all about being able to help with preventative care cancer screening. And so, as we know, through the pandemic, there were many patients kind of fallen through the cracks due to everything else, and really are very much overdue for their different screenings. And so our Poppy bot is able to actually identify who these patients are, but then it can actually go a step further, and it will be able to then segment and stratify these patients in different groups. So it can do things like patients that are very, very overdue and maybe live in a high priority neighborhood would go into a much higher priority in terms of needing outreach and needing their cancer screening, as opposed to patients that maybe are just a month overdue and don't have some of those different factors. And so that's where the bot's able to do the back end work to be able to stratify these different types of patients. And then what's really fantastic about this bot is it actually can do the outreach part and those next actions for patients as well. And so if a patient is identified as needing their colorectal screening done, their FIT test, the bot can actually fill out the FIT test, the FIT requisition on behalf of the clinician. It can put it into the chart, and then it can actually fax it directly to Life Labs. And then the bot after that can then send an ocean secure message to the patient and then saying that the FIT test has been ordered and they should be receiving it. So the bot can actually communicate directly with patients as well. Another example that we have is our PAP workflow. And so what the bot is able to integrate with things like the online appointment booking. So if a patient is identified as needing their Pap smear done, they can get an ocean secure message. And in that message, it will actually have an online appointment booking link where they can kind of fill things out. They can book an appointment that meets the needs, but it just shows how the automation kind of work within different workflows that already exist. And so we've seen really, really fantastic results on this. We just started this bot earlier this year and are excited for this to kind of be continue to be adopted by more and more teams across the province. So in addition to some of the bots that we've developed, kind of what's next on some other components, and I think this is a really exciting one. So you may have heard of something, digital scribes, ambient scribes, AI scribes. Really the idea behind this is that this is a different type of technology where instead of having for an encounter for a clinician that needs to be typing everything out and looking at the screen while hearing everything from a patient, what this software, what this technology is able to do is actually, through a microphone and through the technology, be able to listen to a full encounter. It can capture the whole thing, and then it can actually create the encounter notes in a SOAP note or in other ways, and that documentation, and then directly put it into the EMR. So this way, this actually improves both the clinician and the patient experience, where they can just have a conversation and the technology in the background does the work. And then the clinician can then add notes or things afterwards. But being able to reduce this many keystrokes and typing and be able to have a note generated right into the chart saves a ton of time there. And then really we can even take it a step further from there once there's a clinical note in the chart generated by the software, where we can have automated tools then taking the next actions based off of that encounter. So for example, a patient may come in, and one of the next steps identified by the clinician is that there is an e-referral completed from there. And the bot can actually go in and do that work and create the e-referral after that. So again, an example of the technology being able to work together with other types of technology in order kind of from the end-to-end workflow to improve and reduce some of that administrative burden. So Mohammed had mentioned the HEAL lab that we have, and while we have spoken about a lot of really exciting technology that we can implement to help improve things, it really does start with in the beginning and making sure that we are really understanding the problem and we are applying a co-design approach and a design thinking approach to anything that we do. And so we have something called our HEAL lab, which is our healthcare experience and advancement lab. where we actually bring clinicians and others together. And we start at the very beginning with what are the problems that we're seeing? And how do I identify, what those are and maybe some different solutions from there, instead of just thinking about what technology necessarily can be applied. We start from the other way around. And so with our lab that we have here, we actually have engaged a number of clinicians, and something that we had overwhelmingly heard was that the inbox within the EMR is a huge pain point for administrative burden. There's just too many messages, too much duplication, too many messages that don't actually need to be read but are coming in. And so we're actually working on something that can help with that, with some automation. And so stay tuned for more information, but we are excited to be able to talk a little bit more later in the year about a bot that's able to help with those exactly. In terms of being able to actually get involved with our Heal Lab, we welcome everybody to reach out if you're interested in being part of our different sessions. They're short sessions that can kind of work with your schedule, and we really want to hear from you and apply that co-design thinking. Please see the email or the link at the bottom of this slide right here, and able to learn a little bit more about our Heal Lab and sign up and be a part of it moving forward. So we're getting a little towards the end of the presentation here. And so just leaving you with a few different key takeaways here. Don't need to go through each one of these necessarily in depth, but what you've seen are really a number of different technologies that can really help with the administrative burden and decrease that administrative effort. Different solutions like AI and automation and ambient scribes, they can all work together to do things like share information, to clean up some of the data and systems like your EMR in the background, be able to decrease that administrative effort to free up your primary care team, and really being able to help support integrated care and population health management, either through the early identification of complex patients or being able to automatically connect to patients for some of those different outreach mechanisms that can take staff and clinicians a long time. So many different benefits. And as the more and more that we're developing bots and getting out there, the more potential and different things that we can do. Just a quick note on some EMR availability. We do need to train the bots so that they can interface with the different systems. And so at the moment right now, our bots primarily work in TELUS PS suites. We do have one bot, our Cody bot, available within Oscar and Oscar Pro. And we are exploring and having some of our bots available in Acura QHR as well soon. So we're wanting to have all the bots available in their form here in all the different EMRs soon. And so thank you. Really appreciate the opportunity to talk to all the different great, exciting work that's happening. Encourage you to look at our website, ehealthca.ca, for some more information, or you can contact info@ehealthca as well if you have any other questions. If you are interested in getting started with any of the tools, you can also see the QR code that's there. And even though you can't see that link, we can get you that link as well if you are not able to access the QR codes. Thank you.
Yeah, thanks, Justin. I know we have 5 minutes. Is that right, Melissa? Yeah, okay. So we have 5 minutes left. I think I've answered almost every question in the chat and the Q&A. So, but there are a few themes and there are a few sort of final questions. So I think there's a question about replacing physician assistants. I love our physician assistants in our team. We're not going to replace anyone. I think we have a challenge in terms of health human resources, and this is really to supplement the team and support the team members so they can see more patients and serve more patients and not burn out. So that's really what the intent is. I think a great point about patient co-design, like we have generally had the solutions facing clinicians, and so we've co-designed with clinicians, but as we do more of these facing patients and communicating to patients, that patient co-design is very important. We do that for a number of different initiatives, but in this one, we've focused on more of the clinician up to this point in time. To error-proof solutions, so David asked about error-proofing solutions. We've been doing this for the number of years, and it's just like, we are very conservative in terms of what the bots can do, and test and make sure that clinicians review that. So that we are not making errors. There's a lot of things that can be automated and you can use AI on that are simple to solve. We don't have to get so complicated. Lots of questions about interoperability and EMRs, and maybe just to summarize that, the EMRs are users. So it's like me learning a new system. You give me a username and password, I can get into that. I can get into any EMR. Give me a username and password, I can get into any EMR. But then it's about training the how to use the EMR. So just like you would train me in terms of using an EMR, you have to train the bot in terms of how to use the EMR. So they don't need permission of a vendor to get in. They can just get in like a user, and they can do certain tasks just like you or a staff person would do. And so they don't need any fancy hooks. Now they can, like you can use APIs and they can plug in that way, but I would just think of them simply as a user with a username and password. It's a person sitting beside you on a computer getting into the system. So they can be trained for any system and get into any system and do the work.
Mohammed, can I jump in while you're going
For
through
sure.
those?
Yeah,
I just wanted to highlight that privacy and security isn't something maybe we spoke about directly today, but really privacy and security are paramount and are absolutely critical in this, and something that we, like Mohammed mentioned, we're very conservative and make sure that we are doing everything from that best practice standpoint. And we have a privacy and security team that we engage with from the very beginning all the way to the end of any of our processes. We've gone through privacy impact assessment, threat risk assessments, work with Ontario Health, work with other organizations, making sure that everything that we're doing is following those best practices. Some of the benefits from the bot actually having its own VPN and EMR account is that everything is fully auditable using the systems that a human would access as well. So if I access a system remotely in an EMR and I open up a patient chart and do something, it's recorded that I did that. It will say Justin accessed this and did this on this date. And the bot is exactly the same way. So you can audit everything that the bot can do, looking through all of it using existing systems. And then we have our own reports and systems as well to make sure that every step of the way we can see what the bots are doing. So full transparency, full privacy and security are absolutely critical. And that's something that we have by design in design with all of our tools.
Yeah, thanks, Justin, very much for that. There's a question about how long does it take to train a bot? Are they faster than me or slower than me in terms of being trained?
Well, what's great about it is that the bots might take a little time in the beginning, but then they're very fast at being able to be trained. So what happens is that our bots, when we develop them, I think of them as building blocks. So like a bot is able to log into the EMR, it can go and open up a form, it can run a search. You teach them to do that once, and then when you ask the bot next time, can you please open up a search and do this? It can do it very, very fast. And so what you might actually notice in some of the demo videos and things like that is that sometimes it happens so fast, and you have to go back and actually kind of rewind to see sometimes what it does because the bots are so quick. And so they can be trained rapidly, and they can actually perform the actions much quicker than a human can as well.
Yeah, and then so we're gonna wrap up. I know there's a few sort of other questions. You can the email, if you contact the email on the slide, we will make sure to respond and get it to the right person and respond. I'm gonna hand it back to Melissa to close us off. Thank you very much. Really appreciated all the questions, engagement, and you know, we're happy to get any further questions.
I hope you all enjoyed this informative webinar. I'm blown away. Thank you very much, Dr. Alarakia and Justin, for this very informative presentation. Just watching the chat, I think everybody is absolutely on this and blown away completely. I'm going to launch a satisfaction poll. If everybody could just take a moment, answer, that would be lovely.
Don't worry, you won't hurt our feelings if it's not that great. So please, yeah, share the honest truth, and we're always willing to improve and make things better.
looks like that. Thank you very much for everybody who has answered. And before I continue, so we have launched our community platform. We did that earlier on this last month, actually, at the beginning of October. I encourage all the members to log on and join or start a discussion. All webinar Wednesday recordings are now located in that community platform. So we much appreciate it to get some feedback, and please continue on and discuss. And we have a couple of events coming up. Driving the Future of which is a virtual event that is happening on Wednesday next week. You can still register for that. We also have the Breakfast in Saskatchewan on November 14th. And as I said, this is part of the healthcare innovation rounds, and this is just the first. The next one is November 22nd, and after that is December 6th. Again, I thank everybody for joining, and I do hope that you have taken away a lot of information, and I appreciate everybody being here. Thank you so very much, Dr. Alarakia and Justin. Have a great day, everyone.
Thank you. Take care.
Appreciate it. Thank you.